treatment of bone cancer or bone sarcoma. It is a rare disease of the childhood and the young adults, and it is divided into two types, that is osteogenic sarcoma and the chondrogenic sarcoma and Ewing sarcoma. The chondrogenic sarcoma that get origin from the connective tissue of the bones, while the osteogenic sarcoma that originate from the osteoblasts and osteoclasts, that is cells of the bones. Mostly this cancer originate or take place in the long bones of the skeletal system, that is the long bones of the thigh and the hips and the upper arm, and the skeletal system of the vertebral column, spines. Now the treatment, surgical treatment is the final option when the medical treatment like radiotherapy, chemotherapy has not gained successful rates or the eradication of the cancer or the tumor, bone tumor. Before operative intervention, surgical intervention, biopsy result is necessary to calculate the stages and the histological type of the cancer or the tumor. Moreover, before surgical operations, the orthopedic oncologist, they perform radiotherapy and chemotherapy to shrivel up or the reduce the mass or the size of the tumor. This treatment is also done after the operation or the surgical operation to remove the remnants or the debris of the tumor cells, to wash them away, or the remaining cells to kill them by these two, chemotherapy and radiotherapy, post-operative. This is called as post-operative application of the chemotherapy and the radiotherapy. Now the surgery is essential for localized bone cancer when it is limited within the bone area and it is excised, the diseased portion is excised and is replaced by the bone grafting, and also in modern research therapy, that is the stem cells, they are injected at the site of excision to regenerate the normal bone material. So it is localized sarcoma which is excised by the operative intervention or operative procedure. It can also be applied when the sarcoma has entered in the third phase. The whole of the bone has been invaded by the aggressive growth of the cancer cells. So in that, we have only the one option, that is to remove the whole bone, whether it is the upper arm or the thigh bone or any other bone which has been completely invaded by the cancer cells. And this organ or the portion of the bone is replaced by the prosthetic or artificial, the limb surgery is performed, that is the fitting of the artificial prosthetic, the bone, whether it is upper arm bone, thigh bone, or other vertebra, they are the hip bones, they are reconstructed by artificial or prosthetic bone to make the patient to perform his almost near the normal or the necessary functions. But this procedure, this prosthetic procedure, needs afterwards rehabilitation exercises and the physiotherapy to teach the patient to how to use the prosthetic or the artificial devices or the artificial bone fitted in his body. So these procedures, they are we try the surgeon or the orthopedic oncologist surgeon try to save the limb or the necessary bone to only excise the disease portion or the cancer portion and to replace it by the bone grafting or the stem cell therapy to repair the excised portion of the bone. But when it has invaded whole the bone area, then they have to remove the or do amputation surgery to remove the whole diseased or cancerous bone and to replace by the prosthetic or the mechanical artificial metallic bone, which is fitted, whether it is in the hip joint, whether it is in the upper arm or the upper limb or the lower limb. So this is the prosthetic surgery which is performed to make the patient able to perform his normal necessary. He cannot gain 100% recovery up to the mark, the normal life, but he can perform the necessary function. He can, go to washroom, he can go outside, he can perform slow walk. So these are the process afterwards need physiotherapy and the rehabilitation exercises and education. So the bone cancer is a tumor, is a malignant tumor consisting of osteogenic and chondrogenic sarcoma. It appears in the childhood and the youngster one and up to the age of 30 years and maybe above 30 in the young adults and the old adult, up to old adults. But it is rare in the older ones or elder persons. So it is mostly it is a disease of the children and youngster ones. So the early diagnosis is compulsory to save the life of the youngsters and the children ones who should perform a very cheerful, happy life in their future, bright future. So maximum attention should be given when the children complains pain in his bones, in his or her bones. So immediate diagnostic procedures should be performed. All the procedures, the X-rays, CT scan, PET scans, and ultimately the biopsy must be performed by the pediatric oncologist to early diagnosis, because early diagnosis can save the life of the human children. So it is basically, the disease or the tumor of the children and the young adults or the young children. So we must pay full attention to this field to save and provide the happy, cheerful, and bloomful life to our children's, our offsprings, and our youngster ones.